Anyway, good afternoon, everyone. And I'm sorry we're not all at QBI this afternoon, but it's very good that we're so good at now connecting in this way. So fantastic that we've got everyone online and for what I hope will be a very good afternoon. I want to start first by acknowledging that I am on Yagara and Turrbal country in Brisbane, and I know that we have people from diverse lands here today. I want to acknowledge elders, past, present, and emerging, and acknowledge that this has always been a place of learning and research well before 1788. And I would also like to acknowledge the Indigenous people who are present today. We are very excited to have you with us, Harris. Thank you for joining us. And we're very excited to be part of a group who are all very focused on the importance of brain health and in the importance of the young people in Queensland so that they can thrive. So I'm going to pass over to Harris, who I don't know how long you're going to speak for, Harris, and then we have a panel that will follow.
Actually, Karen, before we go to Harris, we might just ask Sheryl also if she would be doing an acknowledgement to country.
Yeah, that would be fantastic. Yes, sorry, Sheryl.
Thank you,
No
Sheryl.
problem. Hi, everyone. I'm a very proud Aboriginal woman with ancestral ties to Kunya, which is just near outside Callumalla. I'd like to acknowledge the traditional owners and elders of this beautiful land that wherever you are on today. For me, it's the Yagara people in Brisbane. And I'd like to thank them for allowing us to have this function and this meeting on wherever land that you're on. I pay my very deep respects to the past, present, and future traditional owners and elders of this land and the continuation of our culture, spirituality, family, law, community, and educational practices. I'd also like to extend that respect to all Aboriginal and Torres Strait Islander people that are here today. I'd also like to acknowledge that all Aboriginal and Torres Strait Islander people's struggles and hardships that has allowed me to stand here today as an Aboriginal woman running an Indigenous corporation. I'm looking forward to working together, walking together, and healing together with everyone to help our children and families heal and feel strong and deadly. Thanks, Michael.
Thank you very much, Sheryl. And so folks, I'm Michael Hogan. I'm the convener of the Thriving Queensland Kids Partnership. And can I just thank Sheryl for that acknowledgement? And Karen, can I thank you and your team at QBI and Ivan as well and his team at the Queensland Mental Health Commission for co-hosting this gathering this afternoon. We're thrilled to be working together with both QBI and the Queensland Mental Health Commission on this to bring this gathering today to everybody. And thank you all of the folks who've registered to dial in and participate today. And apologies to those we might have inconvenienced by flipping to going virtual. It's my pleasure to introduce Harris Eyre to you. But before that, I would also like to acknowledge and thank Ivan and Sheryl and Elisabeth Hoehn, is the director of the Queensland Centre for Perinatal and Mental Health, for participating as today as well as panelists. So after we hear from Harris, I'm going to curate a little session with Ivan and Elisabeth and Sheryl, reflecting from their lens and perspectives on what Harris has shared with us today, and then we'll throw it open to questions. So without further ado, I'm really pleased to welcome Harris, who's sitting right next to me, as you can see. Harris is a Queenslander and was born in Mackay and educated at JCU in Townsville before going off to the US on a Fulbright scholarship. And as you can imagine, one thing has led to another, and Harris is now in an incredibly influential and interesting position, being a co-lead for the Brain Capital Alliance, co-lead for the OECD's work on neuro-inspired policy initiatives. He's co-authored numerous papers about brain capital and brain health and brain skills, including in the Lancet and with the Brookings Institute and a host of other prestigious journals and channels. But he's also been a terrific collaborator for folks here in Australia, and including Thriving Queensland Kids Partnership and Eracy. A year or so ago, Harris actually participated in a session we ran with QUT that introduced us to then fairly recent work on a brain capital strategy paper. A lot of things have moved on in the last 12 months, and we're really thrilled to have Harris back to speak with us again today and to explore some of the opportunities that might be available for us, as well as what's happening globally. So Harris, I'm going to share your screen. So folks, just give us a moment while we bring up Harris's slide deck. Terrific. Yes. Okay, thank you, Harris. Over to you.
Wonderful. All right. Thank you so much, Michael, for that introduction, and thank you to the co-organizers and panelists, and to Sheryl as well. And so it's wonderful to be here with you all. I hope today that I can be interesting, and I'll probably be a little bit provocative. I hope that it stimulates some interesting discussion during the panel discussion, and then also the Q&A. And it goes without saying that I'm delighted to be back in my home state. I live now in California, but it's always wonderful to be back in Queensland. So thanks for hosting me. Obviously, today I want to talk about Queensland brain health building. And I want to talk about why I think the brain health framing gives us hope. It gives us a kind of fresh new opportunity for innovation. And I want to talk about how I think that's a necessity. I think we've done wonderful things in the fields of neurology and mental health and early childhood development, but where we need to continue to push the boundaries, to refresh, to bring all the great things that have been done before, but continue to move forward in a sort of impactful way. And so I hope today that you come away with a sense of hope about this work, and then also that it's really essential. And I should say that my work is at the global level, with OECD in particular, which is a 38-member country international organization. I think of it as like a sister to the United Nations, and it focuses on economics. So this work is done globally, but it's important that we don't just stay globally sort of in the clouds, flying in the jet stream, but we actually do things locally. And so that's why it's wonderful to see what Thriving Queensland Kids is doing. And I think it's an exemplar, and something I'll talk about at the end about how we want to bring this great work that you're all doing, particularly led by Michael, and bring it into the international debates and discussions, because I think that it's an exemplar, and we can put Queensland furthermore on the map, and you can educate a lot of people around the world with what you're doing. So to brain health, many of you will be aware of this term, and some of you may not be. I come from the field of psychiatry, and also have trained in neurology and in neuroscience. And I think that brain health is an important new kind of framing for how we think about, well-being, mental health, and neurological conditions, etc. As you can see on the slide here, I've said that brain health is not just looking at sort of the deficit model, where we think about how depressed am I, how anxious am I, how much cognitive decline do I have. It's also looking at strengths. So, resilience, creativity, and bringing together strengths and deficits, I think, is important, because sometimes people can get kind of despairing or despondent about just focusing on deficits. So if we can start to broaden the narrative out, it does give hope. I think that it's less stigmatizing, potentially, if we steward this field forward correctly. We know that psychiatry, mental health in particular, have had challenging histories. We're all aware of that in the sort of 100 years ago, but also even just a couple decades ago. And so if we now move and think about a brain health framing, it does help us to reduce the stigma, and we may hopefully see more people coming to seek care and to seek help. And of course, brain health is relevant to every person, and it's not just relevant to sort of treating severe issues, it's relevant to prevention as well. So it's an opportunity to really change a paradigm for how we go about, our brains and operating our day-to-day and being workers and friends and family members. The World Health Organization is really pushing hard the brain health work. And I think that brain health is here, and it's here to stay. And we have to kind of work out how to steward brain health forward, because trying to push it back would be like pushing back the ocean when the tide's coming in. I don't think it's possible. And so I share with you the WHO's position paper that was released a couple of months ago. They said investing in brain health is fundamental to meeting modern societal challenges and to drive innovation. It's not just important for helping people to cope with things like climate change and stress and, you know, recessions and things. It's also important for productivity and creativity. So this is the interesting framing that the WHO has been doing, and we were delighted through our OECD work to consult on this position paper. Up front, I'll say I am a radical provocateur, and it's baked into my journey. And so I wanted to just explain myself a little bit so you know why I'm a little bit provocative. I grew up in Mackay. I went to medical school then immediately in Townsville. I did rotations all throughout North and Far North Queensland, including on Palm Island, which was a wonderful privilege for me. And then literally a couple of months after I was on Palm Island working as a psychiatry registrar or trainee, I was fortunate to get this Fulbright scholarship, and I landed in Beverly Hills to study at UCLA. And so that was a very large culture shock for a young Aussie who had never been over there before. And Beverly Hills is a very interesting place, to put it in a very politically correct way. But I eventually, after a few months, got used to things there and made enough friends to make it work. And I was very privileged that I could sort of learn the high ends of neuroscience and the frontiers of neuroscience at UCLA. I then decided in my career to search for impact and scale with my psychiatry training, with my neuroscience training. And so I went into the world of business, the world of really commercializing or translating neuroscience innovations into products and services, whether they were for mental health conditions like ADHD, autism, psychotic disorders, and things like apps, through to diagnostics, through to new small molecules and drug treatments. I very much have enjoyed being in that world in the last number of years, and that took me ultimately to Houston, Texas. And Houston has many things, and Texas as a state has many things in common with Queensland, not just cattle and big wide open spaces, but people are humble and community minded. So I think growing up in Queensland made me able to kind of survive and thrive in Texas. And now I'm based in San Francisco, which is where I do my work in frontier brain health policy and frontier brain health investing. And so that's through my work globally is how I was fortunate to meet Michael Hoehn, who introduced me and is ultimately why I'm here with you today. So that's a little bit about my journey, which shows you that my mind has been stretched in many different directions, and I'm searching for ways to ultimately to try to impact the brain health of people at scale. I only have recently started sharing my own personal brain health circumstances, and so I'm privileged to be able to share it with you. I've suffered from migraine headaches with visual aura since I was a teenager. It was something that was inherited from my mum. I get one of these migraine with visual aura every month, and it causes that vision change that you can see in the top right hand. It comes out of nowhere. I don't know the triggers. When I was younger as a teenager, when there was no treatment for me, medication, ultimately I get the vision changes, and then I get about 4 hours of a throbbing pinpoint headache deep inside my head that would give me vomiting, and then I would ultimately be pretty wiped out for a whole 24 hours. So it was pretty debilitating and very humbling for me as a young man. I'm very grateful now that in the US, I have come across a neurologist and a particular medication called Ubrevely that I put down there in the bottom right. And this medication now makes sure that I only get the vision changes. I don't get the headache anymore. I don't get the nausea, and I don't get washed out the next day. So for me, this is an example of the wonders of modern neuroscience, how it can develop medications that can, nearly cure my issue. It's technically, I'm now very well controlled. So if I do get a migraine, I know I'm just going to have the vision change for about 45 minutes and then it goes away. And I wanted to mention this because my migraines, I used to view them as a terrible, tragic situation, and why me, and why did my genetics throw me this condition? But now I realize that it conveyed a lot of strengths to me. It's made me very humble, because every month I can be flawed without any anticipation. It makes me look for efficiencies in the way that I go about my work. So I don't want to stress myself too much. So I look for high performance teams and wonderful people, mentors, advisors, colleagues to work with, because I don't ever want to really try to exert myself too hard if I don't have to. So sort of looking at all these ways of hacking to get productivity and efficiency. And it's really given me a lot of empathy having this condition for people that have brain disorders where we don't really understand what causes it and what's going on inside the brain and how to treat it, because I have that too. So I think this is possibly why I am also with you today, that this condition that I've had since I was a teenager has taken me on a journey. And it's meant that I certainly couldn't ever be a surgeon standing over a table for hours and hours on end, which would sort of not be very good for my neck and could trigger migraines. You can't have a surgeon getting vision disturbances in the middle of a surgery. So that's also why I went into the fields of psychiatry, neuroscience, and neurology. Anyway, I hope that is helpful, just framing a little bit about me. So some core questions that we want to get to today is, how do we boost the brain health of Queensland across the lifespan? Of course, with a special emphasis on early childhood, because that's why we're here today, to talk mostly about early childhood and perinatal maternal issues and paternal issues. So that's an interesting question. And I think that throws up a bunch of, question marks about how would we do policy different? How would we do systems change differently? And then how do we boost social cohesion and productivity in Queensland as well? Does brain health confer more social cohesion? Most likely it does. We can talk about that. And does it confer more productivity for people in jobs? Most certainly it does. We'll get less absenteeism and presenteeism in the workplace if we have better brain health. And that could ultimately attract billions more in economic productivity in Queensland every year. Of course, we don't want to harp on productivity solely, because this is all about well-being and really human rights and those more important things. But productivity is important, particularly if we're trying to convince certain stakeholders that this is important. I want to frame up that there are brain challenges that we're dealing with. If you think about these, we're dealing with them as individuals, but we're dealing with them as a state. If we think about the brain infrastructure of Queensland, we're all collectively dealing with this together. We have on the left clinical issues and on the right non-clinical issues. The clinical issues on the left, we're probably more familiar with: stress, depression, long COVID, Alzheimer's disease. On the right, I wanted to put these in because I think these are brain challenges, but they're not conventional brain challenges that we think of. They're certainly, many of them are not things that doctors or healthcare workers are trained on, but they're very challenging to us, to our minds. Disinformation, fake news, I guess is maybe, I haven't been in Australia for the last few years, but in the US, it's a massive issue, as you can see on the news. Air pollution, climate anxiety. I was recently in Egypt at the COP27 climate change conference, and there's a lot of talk about climate anxiety, particularly among youth. And there's a lot of youth that are really in despair and struggling with their education in school and university because they're worried about this existential risk of climate kind of oblivion, if you will. And nanoplastics are being shown that they can cause issues for us. We know now that there's plastic particles on the top of Mount Everest and in the bottom of the Marianas Trench and in the deepest part in the sea. And plastics also been found in human breast milk. And so we don't know what plastics are doing to our brains and to our bodies. It's a frontier area of research. And I think UQ actually has a lab, which was funded by the Minderoo Foundation, which is looking into this. It's a lab that has no plastics in it. It's all made of steel, because any plastic little components that you use in science can contaminate specimens. So anyway, I guess UQ is really the world epicenter of this kind of research. And then educational disruptions during COVID are a big issue for our brains, particularly for young people. There were some statistics and suggestions that COVID, because of how it really disrupted education quality, meant that we've lost a generation of kids, particularly in low and middle income settings. So the confluence, if we step back, of all these brain challenges on the left and on the right that we're dealing with personally, that Queensland's brain Queensland's brain, let's call it that, is dealing with, these are serious. And that's what drives me to think about brain health at scale and novel solutions for how to try to manage this, how to track it, map it, and then also how to develop solutions. We need strong cross-sectoral alignment to tackle these issues. We can't have siloing because these issues don't fit into silos very neatly at all, as you can tell. Wanted to make a special mention. I've just recently traveled from Townsville, which is in the tropics. Queensland, a large portion of Queensland's mass as geographical mass is tropical. And so if we're talking about the Queensland brain, we need to care about tropical issues if we're going to be caring about people up in the north and not just focused on Metro Brisbane. There's a triple brain toxicity in the tropics, biological toxicity. In the tropical areas, there's more infectious diseases, more parasitic illnesses, and a lot more environmental pollutants as well up there. So this is a unique issue in the tropics. There's lots of psychosocial toxicity or just more stress, right? There's more heat stress. And we know, of course, as we go further north, there's more economic disadvantage and deprivation. And so these are significant issues that impact brain health. And then the ecological toxicity, people in these hotter tropical areas are much more exposed to climate change issues. I know, of course, in Brisbane, you're exposed as well. There's been some significant floods that I've been sad to see on the news. But anyway, in the tropics, these are big issues. And we know, of course, in the Pacific Islands that some of the islands are sinking. And that's a real risk from ecology and causing significant stress. So why brain health? Getting back to drilling into this, because it's a holistic understanding of brain issues and solutions. It's not siloing. We need to have people working in their different niches and drilling down and being experts in certain issues, but we also need a space where we can link and understand the dynamics between issues as well. And that's what brain health gives us. So it sort of is a complement to people that are highly specialized in their individual area. It's a new narrative for policy action, for politics and economic innovation. So it's a new way that we can all together go and lobby politicians and philanthropists and bureaucrats to get change in the way that we want. So and we all know, of course, change in the world is part science, but it's also part the terminology and how you sell it and how effective the message is to politicians. I think brain health can accelerate new scientific insights. It can accelerate the way that science pushes into policy. We know that there's a lag between scientific breakthroughs and policy change. And so how do we narrow that down? And I think that's something that obviously the Thriving Queensland Kid Partnership is doing very well. And all of the stakeholders from QBI and the Mental Health Commissioner are working very effectively to translate quickly science into policy. Brain health gives us, reinforces the need for more investment. We know that historically there's been underinvestment in mental health, neurology, early childhood development, education. So this is a new way that we can try to rectify that. And brain health encompasses the lifespan, which is getting back to breaking down silos. We need to think about brain health across the lifespan from, perinatal issues all the way through to Alzheimer's disease. I know in medical school, I wasn't trained much in early childhood brain development. And so, this brain health thing gives us a chance to really go across the lifespan and think about this. And then, of course, there's new data and modeling that will all fall out of this. And I hope ultimately that this emboldens you all because you're all members of the brain community, of the Queensland brain community. Interestingly, when we think about working with OECD, which is this big think tank that's based in Paris that has assisted to the United Nations with all these member countries, the richest nations of the world, the modern economy on the right is often thought of in its own silo, and that climate issues and viruses and brains are not thought about being relevant to how the economy actually operates. And we know, of course, that climate is being now thought of a lot relevant to the economy in many ways. We've just come out of that Egyptian COP27 climate change conference. We know that viruses are not just abstract issues. They can become, pandemics and shut down many countries for long periods of time. So that's no longer being thought of as outside of the economy. So how do we, as the brain community, follow climate into the economic heartland and viral issues into the economic heartland? How does the brain be taken into the economic heartland of the way that all of these economists think? That's really one of the things we're trying to achieve with our OECD work. And we know that Robert Kennedy said that GDP, which is the kind of classic measure of economic vitality, measures everything except that which is worthwhile. So it really, frankly, doesn't have any relevance anymore to much of humanity, society, human flourishing. So GDP is kind of a bust. So what can we do as the brain community to propose adjunctive measures for economic well-being and societal well-being? Can we propose brain health measures? Can we propose early childhood brain development measures? So on and so forth. And of course, we've seen this a little bit in New Zealand with well-being being measured alongside GDP. So this is a move in the right direction. So what could we do in Queensland to work along this pathway? And so you can see this is all about mainstreaming into economics, this brain health work and the brain stuff that we're talking about. It's important to highlight that brain health is relevant across the lifespan, as I mentioned. So this is a graphic that shows you we're all here on this spectrum somewhere. We all have family and friends on the spectrum and co-workers on the spectrum. And so we're all doing things that are good for our brains in blue. We're all doing things that are not so good for our brains in red. I probably had too much red wine on the weekend. So just an interesting graphic and makes us really focus on what we're here to talk about today. I thank Jay Weatherall, who is the former Premier of South Australia, for the inspiration for this slide. And Jay, of course, is a major advocate for early childhood brain development, working now for the Minderoo Foundation with their Thrive by 5 initiative. The argument here is that we have brain health on the y-axis and time on the x-axis. We have the haves of brain health and the have-nots of brain health. If you're a have-not of brain health, you're unfortunately likely in the future to lose your job due to automation or offshoring. If you lose your job, you have less purpose. If you have less purpose, you tend to more likely to get depression, anxiety, and you go on a spiral of then not having the motivation to go and upskill and reskill to stay in the new and modern economy. And we all know, of course, that the economy is getting more and more robotized, or robotization is increasing, and jobs are getting more cognitively intense. So if we don't deal and think about this inequity of brain health, it's just going to widen, because we know on the top level that folks like who are all on this call here today, we have the luxury and ability to sit here and talk about brain health. We're likely to keep up with the cognitive intensity of work. It's not easy, but it's doable. And so incomes in the future will probably continue to rise. We'll continue to be educated through different sorts of mechanisms from our jobs, and we'll get more mastery and self-efficacy, and we'll keep getting more resources. So this is the argument that Jay makes, that if we don't think about brain health at scale for the Queensland brain or for the Australian brain, then we're not going to try to address these issues in a comprehensive way, and we could get further inequality. And we know, of course, we have inequality that's very difficult already to manage. So maybe this is a new vector, brain health is a new vector to think about minimizing inequality. The brain capital terminology that you may have seen associated with me is really taking brain health into the economics field that I talked about before. And a wonderful colleague and friend, Andrew Nevin, who's an economist and is a chief economist of PwC Nigeria, he said, Harris, if we sort out brain capital, everything else will follow in a country. Productivity will get better because people will have less absenteeism and presenteeism. They'll be more creative. Innovation will get better. We'll have more patents and novel algorithms and things, and well-being will get better as well. And there's an argument now, in addition, that as we focus on brain capital, democracy may get stronger, which is very relevant in America because of all of what you've seen on the news. Australia, to me, seems to have a much stronger democracy, if I could be so bold as to say that. But if we have brain capital, we have people that are more pro-democratic in a sense. We have more social cohesion. We have less susceptibility to fake news. You know, fake news is polarizing people into extreme left and extreme right. And also, if we, you know, brain capital is important for productivity, and the productivity of an economy helps it to sustain itself. So the brain capital grant strategy, Michael mentioned, we presented about this before at QUT last year. This is a way of thinking about what we're trying to achieve at the global level. We're developing a dashboard to measure and track this brain capital. We're thinking about this across all policies, not just social policy and health policy, but across all policies. This is relevant, I think, to the state of Queensland. What can we do in the digital portfolio of government? What can we do in the urban design portfolio of government, the city's portfolio, First Nations portfolio, so on and so forth? We need to think forensically across all the portfolios to make sure that we're maximally leveraging this brain health narrative and the benefit that it can drive in public policy. And then, of course, investing is important more on the private sector side, because if this brain capital is an asset, if it's a thing that can be measured, it can be invested in. And so let's think about, you know, new forms of investing like venture capital for new products and services, and venture philanthropy and other types of interesting modern vehicles that we could think about applying in the Queensland context. This is an overview of the OECD initiative that Michael mentioned that I've talked about on a number of occasions. You're welcome to Google it and find it on the internet and check it out. It hosts a bunch of our different work that we've done, and it's been wonderful to see it picked up by different groups. It's been presented to the US Congress on a couple of occasions, and at the United Nations, different parts of the UN on different occasions too. I wanted to make a shout out of a couple of examples of brain health building that, of course, we can learn from and apply in Queensland. We all know Thrive by 5, most probably, which is an initiative of the Minderoo Foundation. It's a wonderful kind of multi-level systems change approach that is being rolled out across Australia and now into different countries. And Eyre and the Thriving Queensland Kids Partnership are engaging with Thrive by 5 to explore synergies and collaborate, which is wonderful. So I encourage you that there's actually a YouTube video from a 6-year-old Queensland girl called Molly Wright that Thrive by 5 put together, and it was the most viewed YouTube video of all last year. For last year, and it's basically this 6-year-old Queensland girl talking about the importance of early childhood brain development from her perspective, and so it's wonderful, and it goes very well overseas when I present it because she speaks with an Australian accent, and so the Americans love it, and people from Europe and such as well. I wanted to shout out Nest, which is obviously a product of Eyre and is very much integrated with Thriving Queensland Kids Partnership. This is a wonderful example of brain health building, and it's being deployed in Queensland. So, you know, again, a lot of my role in brain capital work around the world is finding best practices, highlighting them, promoting them, getting more funding, or cross-pollinating, introducing best practice leaders to people in other parts of the world that need to learn. And so this is an example of something that we'll be talking to people overseas about, and with hopes that they will take it seriously and learn from the best practice. Talked about Thriving Queensland Kids Partnership, which is a wonderful exemplar of what can be done with systems change at multiple levels in a state. And I think you have an opportunity in Queensland because it's a big state, but it's not too big, and it's all fairly well networked together. And so you can really drive some nice systemic change. And you're very lucky to have Michael Hoehn as a lead with his expertise and skills in this kind of systems leadership and systems change work. We have talked about this youth brain capital as being super important at the global level, because youth are the citizens of tomorrow and the workers of tomorrow. We know that youth, particularly teenage girls, are struggling with mental health challenges, most due to social media, TikTok, Instagram, these image-based platforms. So and we of course know there was educational disruption for youth all around the world during COVID. So we need to really think with different partners, and you can see the ones we brought together for this conference event in France earlier in the year. We need to think about how do we optimize youth brain capital? How do we address the challenges and develop solutions? Because it's this youth brain capital concept is part education, part mental health, and part workforce preparedness. It's a very much a sort of hybrid multi-sectoral strategy. It's important to mention that there are many frontier technologies that can be applied to brain health. We know that there are needs to improve diagnosis, screening, and treatment. And the great news is there's all these new technologies that can be deployed, from apps to blood tests to gaming-based therapies, AI, et cetera, et cetera. And so I know that there is a lot of this getting off the ground now in Brisbane. That's wonderful, and further in Queensland as well. And so it's an important area to explore the meaningful and impactful use of these technologies. How do we channel them in a way that they're maximally useful to patients and frontline healthcare workers in Queensland? There is a lot of venture capital investment in brain health technologies. It's increasing exponentially. It's mostly in the US. It's gone from $400 million a year. Last year, it was above $6 billion a year. So you can see an exponential rise, and there's now probably 10 companies in the mental health field that are worth over $1 billion. And so one of the things that I'm acutely aware of as an Australian living in San Francisco near Silicon Valley, which is where most of the VC money is that there's not as much VC money at all in Australia focusing in this area. So how do we fix this? How do we make sure that if you guys on the call want to start a company that has a novel product or service that you can get access to venture capital, and you can then also get access to quickly go over to the US and see if they can support with fundraising. But really, it's about how do we foster things on the Australian side as best as we can. Interestingly, BlackRock is going into the neurology and the neuroscience field now. So this is a sign that the field that we're talking about today, that we're going to be discussing, is super important and super timely. Now is the time to drive change. BlackRock is the world's largest asset manager, managing over $1 trillion US, and they have a new exchange traded fund, which is a grouping of publicly traded shares of mental health and neurology, drug company stocks and biotech stocks. And it's an example that they think that this is a big, important area. And when BlackRock moves into a field like this, many things change when someone on the Wall Street end of town gets serious. So let's see if we can leverage this and ride this wave together as the Queensland brain community. I want to make a shout out about neuro-urbanism. It's a way of thinking about urban design and how can we optimize urban design to improve our brain health. How can we ensure that we have more green space and blue space in cities, which is therapeutic for the brain, helps us to reduce our stress. How do we get less air pollution, more safe bike paths and such around the city so we can get exercise, so on and so forth. You can forensically go through all the parts of urban design and think about what do you modify that's better for the brain, and how do you detract out things from urban design that's bad for the brain. And now coming into the last few slides, I wanted to mention that brain capital, we were just, as I said, in Egypt at the COP27 climate change conference, which you would have seen in the news, talking about brain capital relevant to the climate discussion. And it was a big topic there. We know that, as you said, brain health is important, relevant to climate. We know that as climate extremes continue to increase in the future, wildfires, floods, hurricanes, cyclones, we're going to have more trauma that we're going to have to deal with. So we need to be prepared for that as a country and as a state. We need to have people that have more ecological intelligence so that they're making better decisions about what they decide to buy and eat, and are they doing things that are more environmentally friendly. This is a part of how the brain can help us to sort of prevent or slow down the climate and sustainability challenges that we're talking about. Creativity is important. in addressing the climate agenda in the future? How do we engineer new technologies, new strategies to try to solve climate challenges? Green skills are important for developing sustainable businesses in the future, and digital literacy is key because we know there's a lot of fake news out there in the climate world. There's either news that's overly dramatic or news that's overly denying that climate is a big deal. So digital literacy and helping people to discern real news from bad news is very important. I mentioned before, I'll skip over this, that we're thinking about brain health at scale and how that can strengthen democracy. So there's a stream of work that we have now looking at this. I wanted to mention that diplomacy is important in this field. How do we basically take best practices from Queensland and deploy them in our near neighbors in the Pacific Islands and such? So this is some work we're doing to develop a toolkit for brain health diplomacy. We're doing this in Latin America, but it's definitely relevant all around the world. So if we can work a little bit in Queensland with international relations experts, we can maybe be more effective at developing international consortia to spread best practices into other countries that need it, like in the Pacific Islands. We're talking and lecturing about brain capital policy innovation around the world. This was in Argentina earlier in the year, and we'll be starting this up in Egypt soon. And so in conclusion, what more do I think that Queensland can do in the brain field and brain health? I think keep building up the Thriving Queensland Kid Partnership as an exemplar of systems change excellence, because this will be a beacon for really first-class stuff that you're doing in Queensland that can be teaching people around the world. I think that Queensland could have regional leadership in early childhood brain development with countries in the Pacific Islands. I think that's a very important area for us to think about. And then relevant to global leadership in the early childhood brain space, I think Michael and I are talking about how can Queensland engage in a submission we're going to make for the MacArthur Foundation's 100 and Change grant, which is for $100 million US, which would be looking at a global network of systems change agents that we can quickly go and optimize early childhood development around the world. So those are some ideas that I have for you, and I hope that this was interesting and somewhat provocative, and I look forward to the discussion. Thank you.
Thank you, Harris. And I'll just slide back into the screenshot and turn off the share. Harris, thank you for the incredible breadth of what you've sort of taken us through today. So we are now going to sort of pop into a panel session and get some thoughts and responses from three fantastic Queensland leaders in our space. Elisabeth Hoehn, as I said, is the director of the Queensland Centre for Perinatal Infant Mental Health. Sheryl Batchelor is the founder and director of Yiliyapinya, and Ivan Frkovic is the commissioner for the Queensland Mental Health Commission. So, Sheryl, can I start with you? Given the work you're doing on the ground and particularly with First Nations communities and Queenslanders in schools and playgroups and so on, but also with a view to what's going on globally and from that cultural perspective, what's your reflections on, some of the opportunities and challenges for us in Queensland?
Yeah, thanks, Michael. Thanks so much, Harris. I just got reinvigorated again about when I first read your article about the brain health economy. I remember running around and sharing that with everyone, saying, hey, we should be thinking about brain health and thinking about that it's for everyone. And that's the conversation that I've been having with lots of different people at lots of different systems. And I'm really glad that you brought up that brain health is about everyone. It's really everyone's business. It's even though it's we're talking about early childhood there, it's about everybody's brain, including the workforce. The other thing that I'd really like to say is that the brain health measures that you were talking about before, I think that's absolutely crucial. And that's one of the things that we do is do brain health screening. And the brain health screening is I didn't realize how important that was. We need our allied health professionals to do psychometric assessments and cognitive assessments and things like that. But we do need something that's quick and easy to get a quick measure of a moment in time about how our brain health is today. And that's for all of us. And when I've done that for the workforce, like teachers, child protection workers, things like that, it's really interesting, the conversations around, goodness me, I didn't know my brain was like this. Now, what can I do about it? And I'm really liking that, even though we have a lot of practices talking about strengths, we actually do need to talk about our brain health deficits and know that through the power of neuroplasticity and the power of understanding how the brain works, that we all can change our brain right up until the day that we die. And that's a really important conversation. So the opportunities I see is having some sort of free brain health screener measure or brain health index that they do at the University of Texas, Dallas, that we can all get on to measure how we're going today and what sorts of strengths and weaknesses do I have and what I can do about it. So I think that's really important. I see those opportunities right across the board, not just for our children, but certainly for our children. And one of the brain health screeners that was actually developed here in Australia, there's actually 2 brain health screeners that I absolutely love using. Both of them were developed in Australia, and both of them in the last year were sold to American companies. So we've actually lost some of that innovation, which is a bit disappointing, considering those 2 big companies were actually funded by the federal government in innovation initiatives. So I'd like to see a bit more of that if we can. I think there's big opportunities there. The challenges, I think, for our Indigenous people is understanding what the brain is, because some of our languages, Yiliyapinya means brain for our Mobat Kalamala, but for some of the Indigenous communities that I work in, there is no word for brain. It's about spirit. It's about heart. It's about what that means for them. So there is a language that we have to work around, and we have to tell this, particularly for some of our Indigenous families, it's through the story. The story of the spirit can come through the heart and up to the brain. So we just need to make sure we actually acknowledge that in some languages we actually don't have a word for that. It's through our spirit. And I think the other opportunity, the other sort of like issue that I think needs to be addressed is that the brain health word is so strong. It's a really strong word to say it's for everyone. That in alone is a bit of a threat, because it means that I have to look at myself. And changing a system is at the people level, and it can be quite confronting to look at yourself in regards to, you know, for example, how old you are in the lifespan, the influence of hormones. And I don't want to do this brain test because I'm going to find out that my brain's not working as well as it should be. What happens then? Am I going to lose my job? So there's all these conversations around that we have to be mindful of, that we don't create extra stress. But I also see it that we've got a massive opportunity, and I agree with what you're saying, that the brain health space is massive overseas. And usually I remember going to Canada and America and getting trained in this nearly 8 years ago now, and the conversations were around brain health. They were around digital health at that time. We still haven't quite caught up with all that here. And I'd really think that we need to be talking brain health, because the influence of artificial intelligence as time goes on also creates other cognitive challenges for us that we need to be able to address. So thank you very much, Harris. You've reinvigorated me again to know that the brain health and the healing part that we're trying to do in Yiliyapinya is what we've got a long way to go, but I think we're heading in the right direction. Thank you.
Thank you, Sheryl. And thank you so much for sharing those fantastic insights. Elisabeth, can I ask you to share your reflections and some of your thoughts about those opportunities and challenges?
Yes, thank you very much, Harris, for your presentation. I heard you speak previously, and I found it really challenging, I guess, not so much challenging, but incredibly interesting to think about this, particularly on a much larger scale. I've got a clinical background in child psychiatry and a particular clinical interest in perinatal and infant mental health, so very much early years mental health. And the centre here, the role for the centre here is to develop a continuum of care in perinatal and infant mental health across Queensland, so across sectors and very much in partnership. So I think for us, we've always very much taken an approach to integrate care as much as possible. And last year we had an opportunity with funding from the Queensland Mental Health Commission to put together an actual kind of model to think about that, both from a service delivery point of view, but also from a workforce capacity building point of view, and also a messaging point of view of how we actually spread this message across Queensland, and have been doing a piece of work with Queensland Health Strategic Communications Branch to try and think about how we do that. I think coming from the kind of early years place, early years health, brain health, social and emotional well-being, mental health, whatever the term is, it's very much about how we bring relationship to the table as well. And I think that's the bit that I kind of, when I'm hearing what you're talking about, I fully understand it at that bigger level, at the macro level, at the level that you're talking about trying to get that broader political change and so on. But how do we also keep that connectedness in the conversation, I think, is also a challenge. How do we keep the humanity, the person-focused part of that, and not lose that? Because what we know from all the research and the neuroscience and so on is that the relationship is actually crucial for the development of brain health in the early years. We need healthy adults, but to actually achieve healthy little people, it is really sits in that very strong relationship in between the two, and that being as positive as possible. And that all the social issues and all the economic issues and so on, all the policy issues, should be providing the environment and driving that environment to build that relationship, or provide the space and opportunity for that positive relationship. And for us all to do that, we all have to be in relationship together. And so in many ways, that connectedness and relationship is at the heart of how we actually make this happen, whether it's between countries and leaders or organizations, funders, people on the ground, or the clinical work that we do every day to help our families actually achieve this. And I guess I'm kind of wondering how we can keep that in the conversation, that it's not just entirely about neuroscience and such, but how do we keep the humanity, the social concepts, the those social determinants of this whole picture, and keep that in the dialogue as well. I guess that's kind of where I'm coming from in the reflection. But thank you very much. I think it's we all need to think about this together at every level, and how do we achieve that?
Fantastic. Thanks, Elisabeth. I like it. Harris, to sort of respond, perhaps after we've heard from Ivan as well, and then we'll put it open for questions and comments. Ivan, can we get your reflections and insights, please?
Look, I'll probably take a little bit of a sort of even a higher level than what Elisabeth spoke, because we're obviously working with her on a range of things, but taking obviously a mental health lens. Can I take that? We're trying to sort of make that link between brain health or brain capital, as has been identified, mental capital, but also mental well-being. They're different concepts, they're interlinked, and you can't really look at one without the other. And I think that's the key for us. Again, I'm thinking from a systems perspective. The evidence that we did use and we draw upon a lot in Queensland, but also Australia, has been that 2008 UK Foresight Project report, which clearly, talked about the importance of mental capital and mental well-being. And I haven't seen the new World Health Organization position paper that you were talking about, Harris. I want to see how that builds on that report and adds the sort of the brain capital sort of component to that. But what we see as important from a systems perspective is about getting the system and government to understand. And I have to say in Queensland, I have to say we've had some good traction, probably not as much investment as we would have liked, but we've seen traction from government about the importance, particularly in the early years, of giving every Queensland child the best start. There's a commitment to that, but also started to creep into some of the discussion when I heard the Premier speak about the last budget around a social budget and focusing on some of the, like the massive investment in mental health and now in housing, seeing some of those more broader system investments focusing on more some of those social determinants of health, which obviously impact on a child's life and sets the trajectory. But just picking up Sheryl's point, and I think in that point, yes, we may have made some of those progresses in Queensland. We are starting to progress, but the importance is about you value what you measure, and I'm still not sure that we're measuring the right things in terms of the well-being of our society. But what I think is clear in the Queensland context, and I think we've been able to get that on the agenda, that treatment is not enough, and we're never going to treat ourselves out of these issues. And I think that's starting to be realised, and that the way out is around looking at those human, social, and economic costs of mental illness to be able to look at the bigger picture. And I think we've won those arguments at a broader level, and probably not across all of mental health, particularly with the recent Productivity Commission report, but not so much around the child and youth, because it didn't take such a child and youth perspective, but the whole mental health system. But from a child and youth perspective, what you're talking about and linking, as I said, that sort of brain capital, mental capital, and sort of well-being, it's critical for us because we know that 50% of all mental illness begins before the age of 14. So unless we start to do some of this stuff at that early stage, no wonder the trajectory for a lot of these infants and young people and small people, as Elisabeth says, is set in terms of poor health and mental health outcomes. We know that we can get the best gains. We can get the best gains by early intervention in those early years. But again, shifting the system, yes, we've got a policy focus and we've got a policy frame, but I don't think we've got the investment. But the point that Elisabeth makes, it's about that integration of these responses. We've got a lot of responses from an education perspective, from a child safety, from a health perspective, but we don't have an integrated response to some of these things, which I think is where we need to go. And I think the work that Michael is doing and others will certainly help us sort of in that particular approach. And we're certainly trying to really shine a light on, that unless you focus from, prior to conception, in pregnancy and the first 2,000 days or 4 or 5 years, unless you start to focus your system to address those things, we're not going to be able to change these kids' poor outcome trajectories. And so I think adding the brain health component to the mental capital and mental well-being aspects, which we're driving, which they're so interlinked, will help us in terms of Queensland moving forward in a much more concerted way in this area.
Ivan, thank you so much as well for sharing those thoughts and insights and sort of where it sits in the policy context and the systems context for us in Queensland. Harris, can I just ask you from Sheryl and Elisabeth's and Ivan's comments about what sort of resonates, and there's also quite a bit of chat in the flowing as well around some of those themes like relationships and the intersectionality. The issues come up about food security and nutrition, brain gut interaction. So what's your I guess reflections on those insights from our panel?
Yeah, very, very impressive to hear everyone's thoughts and see the comments in chat. In just responding in a couple of ways, I think that the nutrition point is very important. That's a big part of building our brains is food security and quality nutrition and affordable nutrition. And then of course we know that nutrition can be therapeutic now in mental health. We can, potentially eat healthy food, and it could be as effective for treating depression as an antidepressant medication, or that's what some of the early data is saying. So the point about nutrition is very well taken. I really like Sheryl and what Sheryl's doing at Yiliyapinya, because it's so culturally astute and relevant. And someone said to me, how do we clone 50 or 100 Sheryls around the state? To take this kind of systems change thinking and this innovation in neuroscience and brain health and spirituality and bring it relevant to the particular community, which is what it's ultimately all about. A guy like me can develop all these fancy frameworks at a global level, but it needs to be drilled down as close as possible to what does an individual want and need in a particular part of their world. So Sheryl, it's wonderful to continue to hear about what you're doing and the progress that you're making, and Godspeed, as they say. And then Elisabeth, I totally take your point about we need to keep the humanity in it. The brain capital term was developed specifically to talk to policy makers and philanthropists. It's engineered initially to just talk to them, because brain is interesting and intriguing to them, and capital is something that they're used to thinking about. And so that's what this was initially intended to all be about. And now, we're being pulled to think about, well, what does this actually mean humanity-wise? Let's not just talk about capital and productivity and these economic concepts. Let's humanize this a bit. So I take your point on board, and we're definitely working on it and thinking about it, and recognizing that exactly like collaborating with people like Sheryl is critical, and people like Michael that are doing things around the state is very important, so that we can think about how do we leverage this sort of global narrative with what's going on the ground for people. And the dichotomy of the brain and body is obviously a false dichotomy. We know that the vagus nerve runs right up from the gut into the brain and is this superhighway of hormones and is just, bidirectionally, the brain is influencing the gut and the gut is influencing the brain. And then physical health is very important to mental health as well. So in a sense, yes, we need to take a whole person approach. It's not just the person, it's about their culture and spirituality as well. But I think we're trying to take this brain capital approach to see if we can unlock some new thinking from policy leadership, but can never lose the humanity.
Harris, thank you for those reflections back on the thoughts and insights from our panelists. Folks, we've got some time to throw it open to some questions or comments. So could we see if you're happy to raise your hand, use one of the reaction buttons to raise your hand, and we'll see if we can keep an eye on who's got their hand up. If you'd like to ask a question or make a comment, or if you want to post something in the chat, and we can keep an eye on the chat as well. So any takers? Now we've got quite a few folks on screen, so I'm just going to scoot across. Just take yourself off mute, and hi Janine.
Hi, Michael, and thank you. That was the all amazing presentations, and thank you to the panel for your insights. I have a question for Ivan, and he struck a chord close to my heart in terms of an investment in pregnancy and those really that first 1,000 and 2,000 days of life. How do we get government to really look at that investment? I mean, we've got such good evidence about continuity of care models and better outcomes. The work Indigenous health workers do in health promotion in communities is invaluable. But how do we, because there's so much focus on chronic disease and healthy aging and, community care, and yet we try to bring them back to this continuum of you're not going to have healthy aging until we start investing in pre-pregnancy and pregnancy, and but I just working in that space, I don't see that focus. And I guess that's you mentioned that, and I'd be really interested in what you think of the things about how do we talk to the right people and influence the right people.
Look, I think, that could be a whole PhD in terms of system change, your questions, right? Look, what at least we've tried to do from a policy frame is to get the authorising policy environment to be able to focus on the early years, particularly, preconception, pregnancy, and the first 2,000 days. We've got, I think, a pretty good policy frame and environment, an authorising environment to do that. The challenge now is to get the resource flow to follow that. Now, part of the challenge is with the resource flow, it's probably 3 or 4 options. One is around trying to get new money into that. And there's always a challenge with that because we're always competing with more treatment services at the more severe end. There is around agencies being able to repurpose some of their existing money, or agencies being able to use some of their growth money, which they get on an annual basis, most of them, to be able to focus down that. It's all dependent on the pressures in the system at the particular point in time. So our biggest challenge is, I think the evidence is in, I think we've got the policy frame, but I think because of the pressure, and I mean, I'm sort of using the health example, because of the pressure on the sort of acute end of the system, it's always hard to flow the resources upstream. We've seen that with, my colleagues around who are online today, we've tried for many years to put, and look, and money is flowing, but it's not just health money, it's also what education is investing, what child safety is investing, what youth justice is sort of, so there is buckets of money, but it's hard to really, frame around that and to be able to capture that as part of this investment. But if we take a broader view, so say, for example, the new student wellbeing measure, which say health, which Education Queensland is rolling out, does add to this, even though it's more secondary school rather than actually at the younger ones. We can see the shift upstream. So we're trying to really push early in life and early in the trajectory of the illness. So I think it's a gradual process. I don't think there's any short answer. I don't think there's a lack of willingness from government, but as you know, the pie is only so big, and onto the pressures that, which are there before you. But we're seeing a gradual shift. I have to say, I've been in this job for nearly 6 years, and I've seen a gradual shift towards that. So I'm pretty optimistic that over time we'll see resources flow.
Thank you.
Thanks, Ivan. Thanks, Janine. Karen, back to you.
I guess thank you, Janine and Ivan, because my question follows on, and it is about the early years. We have in this country a new government, and they have at the forefront an early years strategy. My question is, how do we influence that strategy to make brain health the focus? And I guess one of the things that I would want to say, Ros Samble Online has talked about nutrition. Nutrition is also part of care. So my focus is in disadvantaged early education and care services. And when we talk about prevention and inequity, we need to look at there's been a tendency to focus on early learning and education with a little bit of underplaying of care. And I think certainly, Janine, in the area of the perinatal mental health, we don't see care as a bad word, but care of the child care is an important part. And indeed, our data would show that the care and the emotional environments that children get when they're in those early years is showing effects in educational outcomes right through to secondary school in Queensland, where we track them using data linkage. So my question is, how do we get that message across without making brain health seem too broad and fluffier an idea, but where we're providing hard evidence? How do we get in and leverage under that? I know Jay Weatherall was on that panel and we have a number of other people, but how do we do that? Because we don't just need a panel, we need actually our everyday work to enable us to do that.
It's a great question, Karen. And as you say, and Harris has spoken about the work that Jay Weatherall has done through Thrive by 5, and Jay is one of the folks on the advisory group. Interestingly and importantly, along with people like pediatrician Sharon Goldfield, most folks will know of from MCRI, but also Penny Dakin, who's the CEO of Aracy, and Matthew Cox, who's formerly of Logan Together, now of the Brian Foundation in Queensland, and one of the members of the Queensland Kids Funders Alliance, the key sort of consortium of philanthropies that are investing in Thriving Queensland Kids Partnership. So it is, as you say, it's not all about who's on the advisory panel, but that's, I think, hugely significant that those folks are going to be bringing these sort of key themes and agendas to that forum. It was interesting that in the media release that announced the National Year's Summit in February and that advisory group that came out from Minister Rishworth and Minister Ali, the first line was a line about early brain development. Mm. And so the fact that we've started to see politicians, and Dan Andrews in Victoria and Don Perinatal in New South Wales, and we've had some of our ministers, but to see the Commonwealth ministers now using this language to frame their focus and efforts for the National Early Years Strategy, I think augurs really well. So hopefully I think the sort of movement around what's happening nationally is being really influential, and obviously we need to keep up that engagement, keep up the finding ways to effectively communicate this through to decision makers and politicians. But Harris, is there any, I guess, from the more global perspective, or where you've seen shifts in other jurisdictions, other countries or states and provinces, or any other reflections that you'd sort of share on how to influence change?
When I think about this, I think that you have a great model going here with the Thriving Queensland Kids Partnership, because you have a mixture of public sector executives and academics and frontline healthcare workers that are local to the state and philanthropy in the state, and then you're leveraging outside engagement as well from other national figures across those different stakeholder groups. So I think that's part of it, is having the right mixture internally of the state and then the right external influence. And I think that the other thing that I've seen is the leveraging of public-private partnerships that's been effective in other parts of the world at sort of more in the Alzheimer's field. That could be one thing that you could think about in the future when the time's right to layer in. Is there a role of other private sector entities to help to drive change and to leverage the public sector, and the public sector and the nonprofit sector leverages the private sector? So that's sort of could be helpful in the future once you've laid the basic foundations of what you're trying to do.
Thanks, Harris. Does anyone else want to sort of, Sheryl or Elisabeth, do you want to sort of add to any comments on the question that Karen's posed?
I think one of the things is that we need to think about what are the ingredients we need for brain health. And we need different ingredients at different levels. If we're going to have some unifying concept about brain health and how that will build social and emotional well-being, mental health, whatever the sort of next layer is, we need all the things that are coming up in the discussion. Like, we need good nutrition, we need care, and we need nurturance, and we need that to be of a quality, both in our parents, but also in the broader care system, in the education system. We need early beginnings around language development and reading and education from the beginning. But we also need non-violent communities. We also need broader communities that have amenity and have an environment that's supportive. We need support for the carers and the parents, and that kind of village concept that we all are familiar with. But we also then need frameworks and strategies and policies, and we need investment and philanthropy. We have all those ingredients need to be there. And I kind of think we need to kind of, in a way, come up with a menu of what is required for brain health in Queensland and in Australia. I mean, we have a national government now that's talking about a wellbeing budget. And as Michael mentioned, we have a state government that's talking about social policies. we can start to see a shift. But how do we pull all of, and I guess that the whole idea of brain health or the Thriving Queensland Kids Partnership is to try and pull that together in some sort of unified systems way where together our voice is going to be more powerful than each of us individually in our areas. But we kind of need to know what ingredients we actually need to advocate for in the first place, I think.
Thank you, Elizabeth. That's a lovely way to frame the way we think about framing the case for this. So I'm sure that might get other people thinking as well. And please keep those comments and suggestions coming forward in the chat, folks. And of course, we'd love to hear from anybody who's participated today. Please get in touch with us and share your your reflections as well. We'll do a survey after the seminar, of course. But we'd love to hear your reflections as well as your thoughts about what the opportunities are, practical, really on the ground opportunities in whatever the sort of setting that you might be in. There was a comment from Ros about, just came through about linking EC subsidies to specific brain health indicators and prioritising where change is needed most. Karen, do you want to sort of comment about that? Because it sort of picks up on a bit of a theme you mentioned earlier.
Sure, and thank you, Ros, for that comment. One of the things that Australia has is a national quality standard for early education and care. We don't at the moment have measures in that of the wellbeing of our staff who are charged with looking after the development and brain health of our young children. And we don't have indicators of aspects of the children's well-being either. So, for example, we might look at the menus of the nutrition, but we don't know what the quality of the food is. Well, we do. We know from the few reports there are that they're very poor. Some of that coming from Ros's outstanding work in WA. So I think we need to, there is such a leverage there in that every early education and care service in Australia has an inspection, has a remit, has quality, but I don't think currently the brain health idea is well built in there. It's about outputs, not inputs, as it were. It's not about the care inputs, the nutrition inputs. It's more about, what does that look like in, structurally and so on. And I think it's a great, and there may be other places in the system where, those ratings of services are what direct parents to make choices. So it's quite a good idea to have some of those. There are points of leverage there to not only make it as a suggestion of something we should do, but to mandate it, I guess.
Sorry, Michael, you're off. You're on.
Doesn't matter how many times we do this, does it? We still apologies, folks. So, Karen, I just really like that the point you make there about leverage points, like subsidies and like ratings, and sort of linking with Elizabeth's point about ingredients and being quite specific about those to develop if you like, a menu. Sorry about the pun. For making the case and advancing and using those systems levers and leverage points. Sheryl, you've got your hand up. Can I come to you?
Yeah, thank you. I was just going to respond to what you were saying, Karen. I'm so glad that you talked about the well-being of staff, because even though we're wanting these beautiful ingredients and they're very, very important, but do we have the neuro-capable staff to actually engage in the serve and return? Is their brain health at a point where they can manage their stress levels and talk to parents in a way that increases their, that acknowledges their working memory may not be where we want them to be? Can their attention skills be there? There is some brain health screening that you can do from 3-year-olds that was actually developed here in Australia, that's still available to use. That's one of the screeners we use. But we've done some research looking at staff wellbeing in child protection, youth justice, teachers and teacher aides. We've looked at over 1,100 people's brain health screeners. And that data clearly showed us that working memory is the #1 thing that's impacted by stress for our workforce. And we're talking about a couple of hundred people out of that 1,100. So I think that needs to be included here. When we're talking about brain development in the early years, we also need to think about our parents, our carers, our kin, our elders, and our workforce.
Fantastic. Thank you, Sheryl. And I was telling Harris earlier that, as some of you will know, one of the inspirations for our focus on brain builders as a sort of one of the key elements of Thriving Queensland Kids Partnership has been the work in Alberta, a jurisdiction not unlike Queensland in population and economy and an experience of colonialism. And they've now reached over 50,000 Albertans who've either finished or are doing brain story certification. And just imagine if in Queensland in 5 years' time, we can, as I said to Harris, sheep dip, but then provide pathways and scaffolding for all of our workforce, all of our child development workforces in all of our systems and all of our sectors. If we had 50,000 of our Queensland workers and 50,000 of our parents and caregivers, Sheryl, to your point, with this knowledge and with the ability to use the knowledge in the way they either engage with each other or the way they use it in their practice or in their parenting. And that's an ambition that we'd like all the folks on this call and many beyond to embrace and to think about how you might participate as we pick up momentum with our Brain Builders initiative next year. So please stay in touch with us as that picks up momentum, and you'll hear more about that in the new year. We've just got time for perhaps some final remarks from Harris and then from the panel before we close. So Harris, any concluding remarks, please?
I would just say that it's very impressive, the sort of the coalition of stakeholders on this call, and what I've already seen from what you're doing with Nest and with the partnership. And so I'd just say keep it up, and I look forward to applying to this MacArthur Foundation grant with Queensland as a strong partner. And so that's something that Michael and I will be talking more about, and we'll be engaging many of you to help with that. So just very impressed, and keep up the good work. And I'm glad to be supportive and helpful as I can be.
Thanks, Harris. Ivan, back to you.
Just quickly, I think from the discussion, what's also evident for me is around, having a common language, introducing the concepts of brain health or brain builders, or, we've certainly used in mental health, mental capital, mental well-being. I think if we could get a sense of a common language and a common understanding, and the interplay between all of those things, I think would be really critical in terms of a leverage point to be able to move forward. I think particularly like Elisabeth's point around the ingredients, and I think we've got to think about what are those critical ingredients, including the ingredients that we need to support families and workers in a whole range of things. I think we've got to take that holistic sort of view of this, and I think it's the environment that we're in. So things like, for example, when you talked about climate and economy and all those things will all impact on our ability to take this forward. And we've got to understand that in that context. But again, also picking up some of the points that were mentioned earlier by Sheryl and others, we've got to be able to put some measures in place and to be able to measure some of these things as we move forward. Because if we can measure it, then we can actually present it, but then we can also use it as one of our major leverage points.
Fantastic. Thanks, Ivan. Elisabeth. You're on mute.
Yeah, no, it's all right. I just had trouble getting it off. I think I just probably not in the most serious note to end. I was struck with the conversation about inputs and outputs and what Harris had said about the vagus nerve, that in many ways, if we followed the vagus nerve and took its lead, we'd actually have good outcomes. So it likes good inputs like good nutrition, food in the bowel. It likes to be calmed down by relationship. And the outputs that you get from the vagus when you do that are the capacity for conversation, the capacity to build empathy and compassion, and generally kindness. And I think if we kind of kept that in sort of our minds in all of this as well.
Fantastic. Thanks. Thanks, Elizabeth. I think there's some clues here about the way we're going to proceed. And Sheryl, final word to you, and then I'll get Karen to close.
Thanks, Michael. I think I like what Ivan said about the common language. And as I said before, the word brain for some of our Indigenous languages is not there. And so how do we, reframe that by stories? So one way we can communicate brain health in different ways of being is through spirituality, through our connection to land and sea. And when you're talking about, having an ingredient, I think we need to think about what that means from an Indigenous perspective. And when we talked before about Pacific Islanders, those ingredients will be different again. So we just need to be mindful of adding in the cultural and the healing aspect when we're talking about brain health.
Thank you, Sheryl. And Karen, over to you to close us out.
Can't hear you. Can't hear you.
Unmute, Karen.
I'll start again. It's been amazing to see the activity that we've had today online and in conversation here. And thank you, Harris, very much for stimulating that and keeping everyone interested and motivated to make a difference. And I think that's what we've got here is the pivot point is brain health is a central focus for us to make a difference in community and for individuals, and those ingredients will change. Thank you, Sheryl, for those comments, depending on who we're working with and in the context that we're working. But the focus on brain health and on relationships that are important in making sure that we have brain health, on relationships, on those fundamentals like food that's been coming through from our conversations in the chat, all incredibly important. So thank you very much, everyone, for your active participation today. And I hope this won't be the last of it, Michael. So it'll be really great to make sure that we keep that energy flowing. Thanks, everyone, for attending.
Thanks again to Sheryl and Elizabeth and Ivan. Thanks, Karen, for co-hosting with us.